Good evening, everyone. Let me welcome all my viewers once again today evening on Beyond Sugar. As you are aware, Beyond Sugar is created for all of you, and we have done this in collaboration with RSSDI, which is the apex body of diabetologists in India, and Indian Society of Nephrology. The aim is to keep you fully updated and posted on the latest happenings in the field of diabetes in a simple way so that you, as caregivers or having diabetes yourself, can manage yourself in an effective way. Not only we post information for you daily, but we also invite leading doctors from across the country for you who can talk to you as a friend and answer the queries also which you have in mind. A lot of you keep on putting the chats and questions and want to understand more about obesity, weight management, and how that is related to diabetes. So, can high weight lead to diabetes, or by reducing that, can it be managed in a better way? So, today I'm very glad to welcome Dr. Amitabh Soor from the city of Kolkata to answer these questions. Sir, welcome to the program.
Namaste.
Namaste. And before I start taking the audience questions, let me give an introduction also of Dr. Amitabh. He's one of the leading endocrinologists from the city of Kolkata. He did his initial graduation in medicine from the prestigious Kolkata Medical College. And then, after doing his master's, he proceeded for doing super specialized DM course in the field of endocrinology from the prestigious Institute of Postgraduate Medical Education and Research and SSKM Hospital, Kolkata. So he is now having multiple publications in medical journals, and he's authored also some of the chapters in the books. And currently, he is consultant endocrinologist at Peerless Hospital and BK Roy Research Center in Kolkata. Let me, sir, straight away, put you and bring you, on the stage and hand it over to you for your opening comments about this topic, and then we will take in the audience questions also.
First of all, I would like to congratulate you for taking such a important, pragmatic topic for discussion. Yes, obesity and diabetes are connected, and they are connected very strongly. Obesity, despite there are so many risk factors for type 2, developing type 2 diabetes, like age, ethnicity, family history, exposure to endocrine disruptors, etc. But out of all these, actually, obesity is the most important risk factor for development of type 2 diabetes. So this is my opening remarks, and therefore it needs of discussion.
Yeah. No, no, I think, sir, this is you rightly set in the context. And maybe, sir, to begin with, for my viewers, if you can help us understand, now, how do you actually, define obesity? We keep on hearing higher weight, overweight, obesity. So what is actually overweight and obesity? And then, what is the mechanism fundamentally, and how does it, impact the diabetes, or how does the diabetes may impact the weight? If you can share your, knowledge on this.
Obesity, in technical terms, for Indian patients or for Asian Indian patients, is defined as the BMI, that is the body mass index, more than 25. So if the BMI of a person is more than 23, that is 23 to 25, then that person is having overweight. And when the BMI of the person is more than 25, then the person is having obese. And then we have grades of obesity. BMI is very easy to calculate. It is weight of a person in kilogram divided by square of height of the person in meter. So this is one category. But then another important point which you need to keep in mind is Indians, as per their racial or ethnic ethnicity, we are usually metabolically obese, and not only obese, we are also metabolically obese. So what is metabolic obesity? Metabolic obesity is a situation where the person's BMI can be less than 23, but still the person is metabolically obese. That is, the person is having higher visceral fat or higher visceral adiposity than the person should have. Now, this makes it a little vague. Anyone can ask that if my BMI is less than 23, suppose my BMI is 22, and you are saying that I can still be metabolically obese, then how can I calculate? Everybody will not have body fat measurement instrument at their home. So a simple way of seeing it is, or assessing it, is waist circumference. If the waist circumference of a man is more than 95 centimeter and the waist circumference of a woman is more than 85 centimeter, then the person is in all likelihood metabolically obese, even if the BMI is actually less than 23. So this is the understanding about how you can say that this particular person is obese or not.
Okay. Okay. I think this is very, very interesting and easily explained by him. Now, to calculate BMI, you may not be yourself be able to do. It's a, medical professional's job, or you can, look at some of the applications in mobile phone, and it can help you. But the simplest way, which Dr. Amitabh has told us, is that you just calculate the waist circumference, and that can also define in some ways that if you are overweight or obese. Sir, we also, hear that diabetes may happen either because of, insulin resistance as well. That's one of the major factor for having diabetes. And people who are obese, they have higher chances of having some resistance of insulin. Is that true? If
Yeah.
yes,
See,
then what is the probability that, an overweight person may lead to diabetes? Would every overweight or obese person lead to diabetes? Can you help us understand?
okay. So basically, insulin resistance means that the person is having insulin in his or her body, but the insulin is unable to act at the cellular level properly. That's how we say it is insulin. The situation is the state. There's a state of insulin resistance. Now, insulin resistance is usually at three level. It is at the level of liver, at the level of muscle, at the level of fat cells. Now, naturally, I'm telling you in very simple terms that obese people have higher fat, a higher number of fat cells, and their size of fat cell is also higher. Particularly, they also have more visceral fat, and this visceral fat makes the person more likely to have insulin resistance, because the receptor for insulin, receptor through which insulin actually start acting at cellular level, is less expressed in the fat cells of an obese person, and therefore there is higher insulin resistance in obese people compared to their non-obese counterpart. Now, continuing with the same point, when you say that then all obese people should have diabetes, no, it's not like that, because of a very important reason. No amount of insulin resistance, no amount on its own can cause type 2 diabetes. Insulin resistance has to be accompanied by some degree of insulin secretory defect. And this insulin secretory defect is driven by so many factors. One is genetics, another is exposure to endocrine disruptors, etc., etc. Therefore, only those people who have a genetic predisposition, either at the level of family or at the level of racial predisposition, we inherit some genes from our family. We also have some genes which are not from our family, they are from the race through which we belong to. They are more likely to develop insulin secretory defect. And in those patients on prolonged insulin resistance, on having prolonged insulin resistance for maybe some time, there is some amount of insulin secretory defect which comes or which sets in, which pushes them into type 2 diabetes. Now, for those people, you will see many people who are obese and are having perfectly normal glucose milieu. Who are they and how are they are saved from diabetes? They are lucky. They may be having genes which are giving them higher insulin secretory capacity, and therefore, even though they also have high degree of insulin resistance, but still they are lucky that they are not developing type 2 diabetes. They are not that they will never develop, they are at present they are not developing.
Hmm. All right. So I think Dr. Amitabh has helped us understand that what's the mechanism, and how can how can this be related. But from the discussion till now, what we can clearly find out is that uh, if you are having a higher weight or if you are obese, uh, that doesn't mean that everyone will lead to diabetes. But then there are higher chances of having picking up diabetes for people who are obese. And secondly, he also told us that what is the mechanism, that what is the technical mechanism or the biological mechanism that the obesity may lead to diabetes. So now let's understand and move forward. I'd like to ask you that is the progression of disease. So let's say if someone is obese or overweight and he has picked up diabetes, now what about the progression of diabetes or disease per se? Would it be same as compared to if you compare it with a normal weight person, or it will be the situation would be a little more difficult for an obese patient? Anything you'd like to make us understand on this?
Since obese people have higher level of insulin resistance compared to their non-obese counterpart, so therefore progression of diabetes or loss of beta cell function will be relatively higher in obese people compared to their non-diabetic counterpart. Also, it has now been seen in several studies that obesity per se lead to higher incidences of complications in type 2 diabetes in people who have both obesity and diabetes compared to their non-diabetic counterparts. So what are those complications which are seen more frequently? One of them is retinopathy. It can be up to 20 to 30% higher in obese people. That is diabesity. Diabetes and obesity is together called diabesity compared to only type 2 diabetes. Similarly, neuropathy and nephropathy are also seen in higher proportion. Greater patients are having higher ACR if they are having diabesity compared to non-obese counterpart. Now coming to cardiovascular complications, they are also number of CV event is higher in obesity and diabetes compared to only type 2 diabetes. Also, prevalence of heart failure, particularly heart failure with preserved ejection fraction, is higher in diabetes compared to type 2 diabetes alone. Now, stroke incidence is plus minus, but okay, CV event we have said. Coming to malignancies, those malignancies which are seen in type 2 diabetes, diabetes related malignancies, like, for example, CA liver, CA pancreas, CA to some extent urinary bladder. So these carcinomas are also seen to be more common in those who are having diabetes compared to their non diabetic counterpart. Coming to the psychological parameters. Now, you all know that diabetes is now established risk factor for depression. Up to 30% of patients who are having diabetes can have depression. That diabesity, that is presence of diabetes and obesity, makes the person much more likely to have depression compared to only type 2 diabetes. Also, several studies have come up which have shown that quality of life is also poorer in diabetes patient compared to their non-diabetic counterparts.
Okay, so I mean, so the news is definitely not good, in that context, what he has mentioned. So not only an obese person may have a higher chance of having diabetes, but even the progression would be faster. The rate of complications, they may be higher in such a situation. So, so we will leave now the problem here, and we will, look forward to the solutions that, what should be done in such a situation. So, can you say, sir, medically that once someone has picked up diabetes and is overweight or obese, so if the weight is reduced, can that positively, impact the diabetes management overall and the complication, risk reduction?
Sanjeev here lies the good news. There's one thing which is better in type 2 diabetes and obesity than their non-obese counterpart. When you talk about diabetes remission, then those who are having diabetes can more likely enter into remission than their non-obese counterpart having type 2 diabetes. Of course, the remission part is more valid for newly diagnosed type 2 diabetic patient who are newly into type 2 diabetes, either newly diagnosed or having diabetes for 3, 4, 5 years maximum. For them, loss of weight, or if they can reduce body weight by around 15%, then there is a fair chance, very, very good chance that they will enter into remission. And it has been seen that people with higher BMI are more likely to enter into remission compared to their non-diabetic, non-obese counterparts also.
Okay, so that's very good news. So let's stay focused on the good news only, and how we can make this situation towards a better side. So what should sir a person do now? I will come on to that. What as a doctor you will do to such patients, and what you will give in medicines or other procedures. But from the patient perspective, what are the kind of advices you give in terms of lifestyle modifications, diets, etc., which can help a person reduce his weight, and how easy is that, and how much time does it take?
See, for obesity management, lifestyle modification is the core part of the treatment. Though we also have some drugs for treating obesity, but then drugs will also not work uh, uh, if you're not consistent with lifestyle modification. Now, if you're talking about lifestyle modification, there are actually two parts of it. Part one is diet, diet restriction, and second part is exercise, whether aerobic exercises or aerobic or anaerobic exercises. Now, when you talk about the diet part is actually much more relevant for obesity management uh, than the aerobic exercise part. Although the role of exercises is important for overall cardiovascular fitness, but for weight reduction, their role is limited because the loss of calorie which comes out will come out from putting doing aerobic exercise. Any meaningful calorie loss will come after beyond 60 minutes or so, and for majority of patients, they do not do it for that period of time. So diet remains the pivotal thing. Now, which diet is more helpful? That's a question which we face very often. The answer is it does not matter. A balanced diet is actually something which we strongly advocate for, because it has been seen that a balanced diet, maintaining a balanced diet, is actually the easiest way of doing the lifestyle modification. You can actually keep on, you can be consistent with that for years together if your diet is balanced. But even in a balanced diet, when I'm talking about balanced diet, it means that the proportion of various nutrients, for example, carbohydrate, protein, should be the standard one. Like carbohydrate, energy from carbohydrate should not be more than say 50-60%. Energy from protein should not be more than 20-25%, and like that. But the overall calorie has to be restricted. If you don't restrict the intake of calories, then the weight will never come down. So what should be the calorie restriction? Now, this will vary from patient to patient, because it depends on your background intake, what amount of calorie you were taking or are taking at the moment, and your current expenditure of calorie based on your lifestyle. So based on that, your doctor or your dietitian will make a calorie recommendation and will give you a diet plan according to that calorie recommendation, to which you have to stick to. Apart from that, many times we see that only calorie restriction is not working, and patient actually is requiring some medicines also. Time window is difficult to say, but if you can maintain a calorie average calorie loss of say around 500 calorie per day, that means your intake of calorie is at least 400 to 500 less than your total uh, expenditure, which stands at around 1100 to 1200 calorie for most of the people who are sedentary like me, office goers. If I take 1100 to 1200 calorie per day, mostly it will vary from person to person, mostly, then my calorie intake will be around 400 less than my total daily expenditure. If I maintain this consistently, then I will see a weight reduction of approximately 1 to 1.5 kg, or at best 2 kg in a month. And that then this will go on. Higher the baseline BMI, higher is the body weight reduction. So it is easier for a person with a body weight of 100 kg and a BMI of 30 to lose weight, compared to a person having a BMI of say 24 and a weight of say 78 kg. It will be difficult for that person to lose weight compared to that person who is sitting at 100 kg.
Okay, I think these are very important points, and I'm sure our viewers are making a note of it. I think Dr. Amitabh has mentioned multiple things here in his remarks. One thing it's very clear that only a walk in the park may not help you reduce the weight. Diet modification is very, very important. And as I mentioned, the diet has to be balanced. And second thing, कि जो आप intake है आपकी डाइट का जो कैलोरीज आप अंदर ले रहे हैं so that has to be lesser than what you what you spend in your day to day activity and in your daily routine. And if that reduction is happening, then there is a good possibility of you reducing weight. So diet is a subject, sir. I understand it's a we can have a one full program on diet management only, but I must thank you that in such less words you explained the concept at least to our viewers nicely. So also there are a lot of questions people keep on asking. We keep on hearing crash diets, keto diets. The people want to starve themselves to reduce the weight. Now help us understand that if someone is having diabetes and we know all the aspects of diabetes and so how does these things would they help the patient, or can these be dangerous for the patient if someone is already having diabetes?
So I will strongly discourage this kind of diet plan. As I said, we recommend balanced diet. A balanced diet can be a typical Indian diet. It can be Mediterranean diet. Difference between Indian and Mediterranean diet: Mediterranean diet is full of fruits, vegetables, olive oil, etc. These are okay. But then crash diet and keto diet. Keto diet is mainly when the person is taking almost 0 to less than 10% carbohydrate, and remaining 90 out of 90% he's taking 40% in protein and 60% in fat, like that. These are not good because of two reasons. First of all, there is no consistency. You cannot continue it for a very long period of, it's not possible, we are not made for it. Number one. Number two, even if you continue it for maybe a couple of months or maybe a couple of days, it can actually be harmful for your body for two reasons. Such a drastic weight reduction in a very short period of time can adversely affect you metabolically. It can lead to several problems, like it can lead to decompensation of your heart if the patient is having some subtle cardiac problem. It can lead to stone formation at the level of kidney, at the level of gallbladder. Also, interestingly, it can be cosmetically also bad, because fat, if the fat mass is lost too quickly, then residual turns in the body will remain, which will then look very ugly actually. So there are a lot of problem in this crash diet and keto diet. I will strongly discourage it to for anyone.
Okay, so I think be cautious about these things. Dr. Amitabh doesn't recommend such kind of things, especially if
Sanjeevji,
you're
just a
having
small
diabetes.
remark, although you did not ask me this, but
Yeah.
then in continuation of that, please don't compare intermittent fasting to this crash diet and keto diet. Crash diet and keto diet strongly discouraged. Intermittent fasting is okay. We have a lot of studies for intermittent fasting. Intermittent fasting is different from your crash diet and ketogenic diet. What I earlier mentioned was a balanced, restricted diet throughout. But then another strategy which few people take is intermittent fasting. That means they will not restrict themselves for say 3 days in a week, and for 3 days in a week they will take balanced diet but quite restricted. Say for example, 1,000 calorie for 3 days, and then at librium for another 4 days. At librium for 4 days, and 3 days they will take only 1,000 calorie, but a balanced format, not that it very less format but balanced format. So this is called intermittent fasting. It can be done in a weekly basis. It can also be done on a daily basis. In on daily basis, intermittent fasting, what people do is they will take food, again balanced diet, only for a 8 to 10 hour window in a 24-hour period, and for remaining 14 hours they will take only water, they will not take any food. Now this is again also difficult, but intermittent fasting is actually not harmful, and it has shown consistent results also. So it depends on your choice whether you will be consistently taking a balanced or relatively low calorie diet, or you will severely restrict you for a few days and then allow some good food for a couple of days.
All right. So, what about, sir, the medical management of weight reduction? So, we hear that there are a lot of medicines available. We hear about the bariatric surgery for weight reduction and for diabetes remission.
So for
Can you
medical,
throw light on that?
yeah. medical management of weight reduction or surgical management of weight reduction, they come after lifestyle modification only. For medical management, we have drugs like orlistat, which will reduce the fat absorption from GI tract. It is a safe medicine, as safe as it can also be given as OTC prescription. Only problem is some digestion related problem, some indigestion can happen with because of the absence of absorption of fat from the GI tract. With orlistat, the usual dose is 60 milligram thrice daily, or it can also be increased. Then there are drugs like GLP-1 analogs, which have shown good effect in weight reduction, up to 5 to 6% with usual GLP-1 analog. Some modern GLP-1 analog or third generation or whatever you call it, injectable semaglutide or terzepatide, they have shown weight reduction to a tune of up to 15% also. But then, unfortunately, they are still not available in India. I think we hope to get them in 2025. Now, apart from GLP-1 analog and this what I already mentioned, orlistat, we do not have much of agent so far as weight reduction is concerned. But then, type 2 diabetic patients who are taking SGLT2 inhibitors also sometimes see weight reduction with SGLT2 inhibitors. They are also known for it. So these are the things which are available tool with us for weight reduction actually. Uh, Apart from that, surgical management is also there. Bariatric surgery is certainly there. Sleep gastrectomy, etc., can be done. Bariatric surgery is little more effective. It reduces body weight by at least 15, sometimes even 20%. Bariatric surgery has also been shown to cause diabetes remission, mainly because of the weight reduction. So yes, it is an option. But then modern GLP-1 analogs have reduced the bariatric surgery caseload because majority of patients respond to them, and so few only need bariatric surgery. Unlike earlier years when a lot of patients would actually need bariatric surgery.
All right. So I think so. There is more good news which has been shared by Dr. Amitabh. So if you are having higher weight obesity, so there are medical ways, there are surgical ways to manage that. Have a discussion about this with your doctor, and he would be able to give you options which you can then decide on with the help of your doctor. So you initially mentioned in the beginning of your talk about the psychosocial issues related to this. Now imagine someone is having diabetes and then he's overweight as well, and then everyone highlighting as well about this. So there is a there is like gloom across, and as you mentioned that 30% patients they may go into depression as well. So with so much of good news also which you shared about how this can be managed, so help us any message you have for these patients who unfortunately may be feeling little down because of this, and
No,
how
no,
do you guide such patients?
don't feel low. This is completely manageable. Diabetes and obesity, or even if you have only obesity, a lot of new drugs are there. I have mentioned a few of them here. Rest is beyond the scope of discussion, but just don't feel low and talk with your doctor, talk with your endocrinologist. There are a lot of remedies available for this.
Okay, so there is no need for you to feel low or feel down about it. Have a discussion with your doctor. There is a solution to every problem. Only thing is that I think we all as a team has to have to work hard towards this, and you will be able to manage it. So finally, before I conclude this whole program, first of all, I must thank you. I think you have helped us understand this whole subject so wonderfully. Now, just one final question before I end, and that is around the monitoring. Now, monitoring of blood sugar, diabetes, that's again an important pillar in diabetes management. So, is it different, for patients who are obese? Do they need more frequent monitoring, or do they have little more fluctuations of their blood sugar levels? Anything which you would like to
Yeah,
comment on that?
yeah, definitely. Those who are having obesity, they require more frequent blood glucose monitoring. Those who are having both that is diabetes and obesity, they require more frequent monitoring for blood glucose. It's true.
And any advice how frequently it has to be done?
No, it's not like that. It will depend on patient to patient. And just go away, beta. Just go away, please. So my advice will be that yeah, it will vary from patient to patient. So it's not like that. You have to talk with your doctor and then decide that whether what should be the ideal frequency of monitoring.
Okay. So have a discussion again. This is very important. The monitoring also is an important pillar. I must thank you, Dr. Amitabh, here for being so kind and sharing all these aspects about obesity and diabetes, and how to handle this whole situation. But again, before I conclude this whole program, I'll just give it back to you in case you like to summarize the your thoughts about today's discussion, or if there is anything important which we have missed and you still want to highlight.
Everything we have discussed, only we have to just give the last message to our patients that please don't feel low about having obesity or having diabetes per se. Yes, people who are having both obesity and diabetes have to be a little more conscious. They should be a little more frequent in getting themselves tested and talking to your endocrinologist regarding management of both obesity and diabetes, and not just diabetes.
All right. So, thank you very much, Dr. Amitabh. And I think for all our patients who have watched us live today, for all our viewers, and who would be, watching this later on as well. See, it's very, very important to understand that a higher weight or obesity has a direct correlation with either picking up diabetes or the worsening or management of diabetes as well. So there is, a complete correlation. However, the good news is that there are multiple strategies which a patient can implement, or which a doctor can, tell to his patient, and if there are medical and surgical interventions through which this can be managed as well. And then finally, no need to feel low. Your doctors are there to help you, and the situation is completely manageable. Anyone in your family or friend circle, if they have diabetes, or they have anyone in their home who's having diabetes, you can simply share the link of this program, and today's conversation can be very, very useful for them. In case you live anywhere in Kolkata or in Bengal, you can always visit Dr. Amitabh Sur. He is in Peerless Hospital in Kolkata. If you are listening to us anywhere far off in the country, any other city, so please discuss these aspects with your doctor, as recommended by Dr. Amitabh. Thank you so very much, sir, for joining us today and taking your time out. And I must thank all our viewers as well who joined us live or who will be watching us later on. So with this, thank you so very much, and good night to